On the 17th of February 2021, 3,900 vaccines, which are the Johnson & Johnson vaccines, arrived here in the Northwest Province. And already on the 18th of February in 2021, which is the following day, the vaccination drive started and frontline workers were already vaccinated on that day. Now, the other batch of the Johnson & Johnson vaccine has arrived here in the Northwest Province, and we would really like to know how many are they, and about also the vaccination drive as to whether it's still about the frontline workers or it's extended to other community members or other citizens of South Africa. And to understand that better, we are joined by the MEC of Health here in the Northwest Province, Mr. Madoda Sambatha. MEC, thank you very much for making time to speak with us. Please do tell us about another batch of the Johnson & Johnson vaccine that has arrived here, and how many people we're targeting to vaccinate in this instance.
Thank you very much. We have received a second batch, and in the second batch we have received 5,360. This 5,360, it's meant to do a second batch vaccination, still of phase 1 of community health workers. On registration, we currently have 34,000 of healthcare workers registered. So it means we will do from the 34,000 healthcare workers. But in this instance, we are going to do it in both public and at least one private hospital. Remember, the previous one was only done in public hospitals. The arrangement is such that national purchases, when they deliver to a province, they have a counted number for both private and for public. In this instance, Life Peglaray in Rustenburg would be for private, but we have added 2 extra public hospitals in this phase. We've added Mafikeng Provincial Hospital, we've added Moses Kotane, which therefore means in the capital city, with effect from Sunday, the vaccine has arrived in Northwest, the second batch. That's what we have.
And I heard you saying that you're also going to include the traditional healers. Have they already registered, and how have they registered? Where did you have a form or a way that you administered the registration for vaccination?
We have had outreach programs in each district, engaging with traditional health practitioners. We're doing so to give them an awareness that structures regionally and provincially of traditional health healers must start an active campaign of registration for traditional health healers. What you must also understand is that the process of registration, it's not that complicated. You register and it evenly gives you the list of facilities you are closest to based on the address. You then choose which, in this instance themselves, it's facilities that they are using on daily basis whenever they would want to consult health. They are included on the basis that they do have a sizable number of people who consult them. And if they were not to be protected, it might be easier for them to transmit to the people that consult them. In this instance, community health workers too, remember, they are part of health delivery. But in a program of health, there's also a sequencing, which means who starts first in a health facility. And I can tell you, in the sequencing, though I'm MEC, I'm number 4. So I'm still not going to get in the second batch. I may get in the third batch when they've at least finished all the sequences 3 above me, because I'm counted under administration.
As an ordinary citizen of this province, when am I going to get vaccinated? When is the vaccination drive going to get to, your ordinary people on the ground?
Ordinary citizens, the second phase, it's for them, second and third. In the second phase, We are dealing with ordinary South Africans who are based in facilities, your home-based care, your old age homes, your prisons, any area that has captive community residing there. And then we're dealing with people above 60 years. Then we deal with people above 18 years, but who have comorbidities. So South Africans, the actual vaccine for public starts at phase 2 and then ends at phase 3. In Northwest, the expectation is that by phase 3, we must have reached 2.7 million people residing in Northwest Province.
And lastly, MEC, would you say with regards to the number of health or rather frontline workers who have already gotten vaccinated, are you happy with how with the turnout there, or the numbers of people who have been vaccinated?
For now, the first phase has then started as a success. First, the number of healthcare workers who did come up front, it's a good number. Secondly, the actual vaccine on its own became a success because there were no major incidents of complications post-vaccination, which therefore tells you that the success on healthcare workers, it's an indication and a mobilization and motivation for South Africans to be themselves ready for the vaccination. But what we must then do in the process is that each one of us who's waiting for the date of vaccination must abide by all the prevention measures. Because you must still wear your mask, you must still social distance, you must still have cough etiquette, you must wash hands, you must report to a facility whenever you are sick. Remember, vaccination is not for people who are confirmed positive. When you are confirmed positive, you are a COVID management case, not a vaccination case.
MEC, thank you very much for your time. Mr. Madoda Sambatha is the MEC of Health here in the Northwest Province, and from us here in the Northwest Capital, Mahikeng is back to you in studio.